top 10 largest occupations, or the top one at least.
County government.
Government?
Government.
Hospital?
Hospital, school board.
Real
estate agents.
Hospitality.
Yeah, actually, fun fact, there are only 3 counties for which the hospital is one of the top 4 employers, and Sarasota is one of them. I forget what the other 2 are. But yes, these are the top 10 occupations. Registered nurses and nursing assistants are up there. All the other ones are mostly food service, retail, and clerical work.
So realtors are not on that list?
Nope.
Over here.
Yeah. So then we looked at the median incomes and the income needed, the median income needed to purchase a median priced home in Sarasota County. And we saw that registered nurses, out of the top 10 most common occupations in Sarasota County, are the only ones that can really afford a median priced home. And then if you look at it by race, and so this might be a little confusing, this is the median income in Sarasota, and this is the median income needed to purchase a median priced home. So if you look at Sarasota, it's a nice picture, but if you look at it by race, only the white and Asian populations earn enough to comfortably afford a home at that price.
Is your income level per capita?
Yeah.
Okay, because very often you'll see statistics presented about Sarasota, which is a household income, which really fudges that figure.
Mm-hmm.
Thank you.
So now this is area median income and the amount of affordable and available units. So we can see that for low-income families or low-income households, there is a deficit in available units if you're 30, 40, or 50% below the area median income. And then there's another way to look at it, which is if you're 30% below the area median income, there are 22 units available for every 100 households that are 30% below the median income, which is what our homelessness problem is attributed to, for the large part. So this is a different thing that we're looking at. So we looked at the largest occupations by employment number, the number of employees. FloridaJobs.org, which is, if you get unemployment benefits, you're automatically signed up with them to get jobs, and they throw job ads your way. They created a database where they looked at all the job ads for Sarasota County and determined short-term demand by occupation by looking at the number of job ads for each occupation. And these are the occupations in Sarasota and Manatee that have the largest demand. So registered nurses are on top there. And then you have retail, truck drivers, cleaners, and more low-skilled occupations, except we have construction supervisors, and we have retail supervisors. And again, we look at the wages, and now Florida, the supply and demand database that they created looks at median wage hourly. So we determined the hourly median wage, which is $18.36 an hour. And we see that only 3 short-term high-demand professions make above that median wage. That's the registered nurses, the retail supervisors, and the construction supervisors. So another thing that the database lets us do is look at the typical educational requirement for each occupation that exists in Sarasota County. So we put it in a pie graph to see how many occupations there are broken up by educational requirement. And we see that a little less than half of all occupations locations in Sarasota County require either a high school diploma, which is this, or less than a high school diploma. And then you see a quarter require typically a bachelor's degree. So it's interesting. I don't really know what conclusions can be made from that, except that there's more demand for lower skilled labor and less educational attainment. So here's another way to look at it. So now we have the number of occupations by each educational level. So it's kind of small, but this is 1, 2, 3, 4, 5, 6, 7, 8. On the left, there's a little key for what each of the numbers mean, but very simply, 1 is the lowest level of educational attainment, less than high school. 8 is the highest level, doctoral or professional degree. And then this is wage. So, for example, 1 being less than high school is in this lower wage spectrum. And then once you get a high school diploma, this huge door is open for you for all these other really horrible jobs that you can do. And then, let me just have this. So 3 is some college but no degree. So these are all more specialized jobs that require licenses, like technicians, IT professionals. Then 4 is your post-secondary non-degree, so the AAs or those are 4 through 5 are also more specialized and IT professions, and then you get to your 6 bachelor's degree. But then there is this door that opens up here, and here there are people working in finance, and there are people that are business administrators, and then there are people down here that are kind of on the same level as these people. And these are the artists, directors, writers, and then you have the master's degree, which doesn't seem like an appealing thing to do just based on this. But this just allows you more specialization. There's the scientists, psychologists, lawyers, researchers are all in this category here. So, excuse me. And then we have the breakdown of people in poverty. Sarasota County is lucky enough to have a lower poverty rate than both the state of Florida and the United States. And I'm going to pass it over to John.
So this poverty rate that is typically used to describe poverty is something that was developed back in the 1970s, and the methodology for it really hasn't changed since. United Way of Florida wanted to take a look at what it was really costing people to live in our state and the various counties. So they underwent a study utilizing a ton of data and basically wanted to look at, if we take the cost of housing, childcare, food, transport, healthcare, taxes, and a little bit of miscellaneous, although I must say not much, and figure out how much does someone have to earn to be asset limited, income constrained, employed. So these are people who are employed, but they're limited in how much they make. And these are people who are probably one major car repair away from not having a car. Or they're one, pink slip away from just total economic collapse. And so what they found was that on top of those who are in poverty, that 11% of our population in Sarasota County, 30% of the population is in the ALICE category, that asset limited, income constrained, employed. You stack those two up and it comes to 41% of our population is in an economic stress. Now this particular graphic kind of shows the opposite of that, how many people are above ALICE, and it's 58%. And in this particular case, these are household figures, not per capita on the income. But I think this opened a lot of people's eyes to the fact that, there's kind of a tale of two cities here in Sarasota, and that is we have exceptionally wealthy people many of whom have made that wealth here or brought it from somewhere else. We've got a lot of people out there, and Juliana's just described, some of the typical jobs, the highest employed jobs are often not the really great ones. And then just kind of to keep the show rolling along here, this is from the most recent point of time survey conducted by the Suncoast Partnership to End Homelessness. 1,365 homeless people in Sarasota County, with an estimated 80% of them within the city of Sarasota. This is a little infographic that kind of breaks down, I think probably helps us understand a little bit better about who actually is homeless. 20% of that number are children. 17% are Black or African American. 27% reported not having a place to stay for over a year. This is your chronically homeless. This is not someone who just became homeless. And then 54% reported having some sort of disabling condition. Now, this is the point in time survey where they go out on one day and they go out and interview and talk to and enumerate all the folks that they can find that are homeless in the Sarasota area. Another thing that Scope does is break out information geographically, and I know some of you have already picked up one of these little data samplers. These are about 2 years old now, but there's enough here that everybody can grab one. Those little samplers are all about showing data through maps. This was a little exercise we did for a new college group, and we wanted to kind of compare and contrast two neighborhoods that were right next door to one another, but are actually quite different. So you've got Indian Beach, platted in 1891 over on the bayfront. You got Newtown, platted in 1914, just right across the street. And here's a little infographic that kind of shows how things are a little different between Indian Beach and Newtown. So the unemployment rate in Indian Beach, 9.5%. Unemployment rate in Newtown, 21.2%. People with a high school education, it's almost a reverse number here. Indian Beach, almost 80% of the folks have a high school education. In Newtown, only 20%. The ethnicity, similarly, is almost directly opposite, whereas Newtown is 10% white, Indian Beach is 85%. And household income, median income in Newtown, $17,000 versus $61,000 in Indian Beach. So it's really just there to show the different segments of the community, even though they might be right next door to one another, experience very different economic situation. Here's just one other slide. Single mothers, Indian Beach, which is census tract number 9 versus census tract number 3 in Newtown. Okay, now we got a section on learning, which is education. I think Juliana's going to take a couple of these.
So third grade reading is a measure that is getting a lot of attention right now because there's a consensus that it's a really good indicator of future academic success. And it's measured typically by the third grade reading FCAT. 77% of Sarasota students have passed the FCAT compared to Florida's 57. Do you have the clicker?
While that average looks a lot better than the state, it sure doesn't look good for Sarasota. If you think about the 77% or whatever that number was, it means that the remainder of those folks. Go back to that slide.
Okay.
You know, so 77% sounds great when you compare it to 57%, but you got to worry about that, you know, the 23% of kids that can't read in third grade. And so what this boils down to is you've got 4 elementary schools in the county where less than 50% of the students can read at third grade level. So there's a lot of interventions going on right now with the National Campaign for Grade Level Reading, and the Community Foundation and the Patterson Foundation are kind of heading that up. They're making some good progress. If we had shown you this slide last year, it was 71% of the students passed. So there's been a 6% increase just in the last year. Right. Now, FCAT is changing, and they're not going to have the same test next year. So our curve is going to be truncated, and then we'll have to pick it up with whatever new test they come up with and kind of study it from there.
Right, man said 57% is Florida.
That's your state of Florida right there.
All right.
Your microphone stopped working.
Okay, we'll just hit this one.
Testing. All right. Yeah, so there is a huge attainment gap gap when it comes to socioeconomic status, which is measured here through whether or not someone receives free and reduced lunch. So, and it's still FCAT, reading, the third grade reading FCAT. So if you do receive free and reduced lunch, you're the blue, and if you don't, you're the orange. So consistently, there's been about a 20% gap between students that do and don't receive the lunch assistance. Then if we look at it by race, there's a gap between the white population and both of the minority populations. For the Hispanic population, it's a 20% gap. For the African American population, it's typically twice as high. Well, for the white population as it is for the African American population. So dropout rates have decreased from 2.2% in 2011 to 2012 to 1.5% in Sarasota County. But if we look at it by race, there's large discrepancies, with Asian populations having a very low dropout rate of 0.3%, and the African American population having the highest dropout rate of 33.3%. And then the graduation rate in Sarasota has been steady for the last 3 years at 75, 76, and staying at 76, but state of Florida graduation rate has been increasing and is now 5% higher than that of Sarasota.
No,
I'm sorry, we're doing better than Florida, of course. I'm losing my mind, it's a little bit late, I've been work all day, you know, we all feel it. We can look at it by high school and see that this is Sarasota's graduation rate. The only 3 high schools that are below this graduation rate are Booker, Sarasota, and Northport. All the other ones are higher, with Pineview having 100%, which is, in my opinion, impossible. So I think they're fudging it a little bit. We can also look at graduation rates by race and see a similar pattern with the Asian population having the highest graduation rate and the minority populations having lower graduation rates.
Okay, we'll look at some health data and try to get through some more of this stuff so we have plenty of time. Here's one that I found particularly interesting. Heavy binge drinking by adults in Sarasota County. These are episodes that are documented. This data is coming from the state of Florida, and so you're looking at a much higher rate for Sarasota than for Florida, and these are rates at per 100,000 residents. So we're up to having almost 400,000 residents now. So you might as well just multiply those numbers times 4. Here you have heavy binge drinking from ages 10 to 17 in Sarasota. Also, again, Sarasota on top, somehow exceeding the state of Florida. So we're doing better in school, but we're doing a lot more binge drinking. Kind of interesting.
How many of those numbers, or how many of those binge drinking problems have been created by our local government?
How many of the, here, hold on. Mike, this one's, how many of the binge drinking episodes have been created by
Our local government.
our local government?
Governments.
I don't have an answer for that question.
John, can I add to that? I've talked to a couple of liquor vendors in town, and they explain it this way. A lot of seniors who can't afford medications are alcoholically medicated, so it's cheaper than buying pills. And this is, according to the sales folks, this is the #1 county to sell booze in the U.S.
Get out.
I've heard that before. We don't have a slide for that. And then this one is, HIV cases, rate of new HIV cases, luckily this is being pushed down both in the state and the county, but you also see a little bit of an uptick here in the more recent years. Now these are 3-year rolling averages. This is something that the state health department does with most of their statistics. They do it on a 3-year rolling average. Again, in terms of if you broke it down by race, you'd find that African Americans make up 30% of it, but they only represent 8% of the population. So there's, whether it's in economics or education, we also see health disparities due to race and ethnicity in our community. And someone who's been studying that is Dr. Lisa Merritt from Multicultural Health Institute, and we've been sharing a lot of information back and forth to gain a better understanding of kind of what's going on out there. Now, this is diabetes diagnosis by income. So this is where we're kind of pairing income levels with an incidence of a particular medical condition. And so I don't know what you might think before you saw this slide, but basically the poorer you are, the greater chance of a diabetes diagnosis. And this is not childhood diabetes. This is adult diabetes. And so one might think that as you got more wealthy, you had more food to eat. But really what's probably being seen here is that when you are poor, you're not eating as good of food, and it's creating this kind of a situation. And this one should be titled Rate of Hospitalizations Preventable by Vaccinations, which is what this data actually represents. And you can see that Florida has been kind of dipping down a little bit and then starting to tilt back up. And in Sarasota, that is going up. Again, these aren't huge numbers, but you got to multiply that times 4 to get basically what's going on in the community. So you talk about some of the other ones. Infants in foster care. This is one area where Sarasota has not quite double, but a larger number of infants in foster care than even the state of Florida. So we don't know a whole lot about what's going on behind the scenes there.
Your prior slide, do you have a breakdown whether it's adults or children?
I do not. It would be combined. Okay. We haven't broken it out, but if that's something that would be of interest.
Can you repeat the question for the preventable vaccination slide?
The question was, do we have this slide broken out for children and adults? And this is a compilation of both. But as you can see, I mean, one of the things we like to do is break things out all different kind of ways to kind of see what's really going on. Infants in foster care, rate of verified child abuse investigations. Now, this is one where this is Sarasota County's number, and this is the rest of the state of Florida. So all of a sudden, we're not looking as good as the state of Florida. And we had some discussion in one of the roadshow events, and someone pointed out, well, it could be that in a county like Sarasota, there's more child abuse reported, and that in other counties it might not go as reported.